Yeah, I mean, work requirements are more of a really more of a consumer issue, at least from the coverage side, right? When you think about the way that work requirements function, is that it results in fewer. What we've seen is that that results in fewer people being covered, rightly or wrongly, just sort of based on the way that those work requirements are administered. But again, where particularly where adults, low-income adults, uh, don't have healthcare coverage, then they're often that means that they're not seeking care. Um, and either then that that care where it's an emergency care then is not reimbursed, and so that hospitals have to account for that, and it becomes charity care, or people forego care. And then what we know is that that results in ultimately the cost of care typically being higher than it would have been if people receive preventative care. And so, I think there was one hospital CFO this morning that noted sort of strong headwinds for healthcare in the future, and I think that's right. It's a difficult, it's sort of difficult to square the fact that healthcare providers, are expected to be paid for the services that they furnish, and yet the federal government's, considering this sort of massive cut to, one of the country's largest health insurance programs.
ACAP represents not-for-profit community-based health plans, and many of our health plans do nothing but Medicaid coverage. They typically do it within a single state or within a single region of a single state, meaning they don't have a ton of flexibility to shift their operations around to another place that's more lucrative or another program that's more lucrative, although about half of them are in the Medicare program as well. Um, I we're doing whatever we can to forestall the big magnitude of Medicaid cuts such that our members and the people they serve are not unduly harmed. But if cuts to Medicaid do equal hundreds of billions of dollars, I am very fearful that the community-based plans will be drastically harmed by that. I hope they won't go out of business, right? We're not forecasting that yet, but they will be harmed. They will lose enrollment and they will struggle with rates. The states will be challenged to pay adequate and actuarially sound rates to plans because of the loss of federal dollars to the state Medicaid budgets. And yes, I think that the community-based plans will be very badly harmed.